from a topic. So this is how we are going to discuss. And I think last 5 to 10 minutes we'll have a discussion on queries. So you all will be aware of the third paper syllabus. It starts from Anavasrodhushti Vikaras. So the maximum mark covers in Anavasrodhus is 16 marks. Okay. So we will discuss like this every topics and based on the Srodhas and how much marks it holds. So again, it's 16 marks. Anavasrodhus are going to come. So it includes Agnimandya, Aruji, Arojaga, Ajirna, Alasaga, Visujiga, Vilambiga, Anaha, Adoba, Atmana, Amlabitta, Basmaga, Parinama Shula, Nadravashula, and Chardi, Gulma, Grahani. Then some of the modern portions like APDs, acid peptic diseases, and GERD, gastroesophageal reflux disease, Grahani, irritable bowel syndrome. Then abdominal malignancies, CA pancreas, CA duodenum, stomach. So these are the main areas which will be covered in the Anavasrodhus. So among which you can see that some of the points I have marked in red color. So these are the main areas from where we can expect questions. So I'll just show you some of the question models. If you're considering Grahani, construct Doshaja Chikilsa and Chikilsa Yojana, including Aushadha Yoga, Rasayana, and Patya Avatya of Grahani. This is taken from the syllabus itself. So even questions can be structured in the same way, what is given in the syllabus. So here you can see the construct Doshaja Chikilsa, Chikilsa Yojana, including Aushadha Yoga, Rasayana, and Patya Avatya of Grahani. Okay. Then another if you're considering explain Samprapti Vikhatana. So there are 2-3 types of questions. In one question you can expect Doshaja Chikilsa, Chikilsa Yojana, and Aushadha Yoga, Rasayana, all those things. Another way of asking is explain Samprapti Vikhatana. So this is especially this is very important in Kaya Chikilsa syllabus. For most of the diseases they are asking Samprapti Vikhatana like treatment. So this was not present before in Kaya Chikilsa examination, but in new syllabus you can see the treatment as per Samprapti Vikhatana, Chikilsa Sutra, Aushadha Yoga, and Patyavatya of Chardi. This is also taken from the syllabus itself. I have not formed these questions. This is the syllabus points where the syllabus description is given. So I have taken these points from the syllabus itself. So such questions you can expect. See, in this point almost 16 marks are covered. So you can expect one 10 marks question from this point and as well as a 5-mark question, and remaining 1 or 2 mark question you can expect as MCQ also. So as you all know, you will be having 10 marks for 4 questions of 10 marks, 8 questions of 5 marks, and 20 questions of MCQs. So this is the pattern. I think you all know this pattern. Then another question is illustrate Samprapti Vikhatana, Chikilsa Sutra, and here also Samprapti Vikhatana comes. Okay. Illustrate Samprapti Vikhatana, Chikilsa Sutra, Chikilsa Yojana, including Aushadha Yoga and Patyavatya of Amlabitta. You can see in Chardi and Amlabitta it's given like you have to start with the Samprapti Vikhatana, then go for Chikilsa Sutra, Chikilsa Yojana, including Aushadha Yoga and Patyavatya. So I think you know the format. Even classes will be taken in this format only. If the colleges is not taken in this format, you can just tell me at the end. I will show how these questions to be answered based on Samprapti Vikhatana and all those things. And one more other important part is state the Palasruti, Matra, Sevana Kala, and Anuban of various yoga mentioned in Anavasrodhushti. This also you can expect for 10 marks. So you can this here Anupana, Sevanakala, Matra, Phalasruti of different way. We have different yoga. Annava Swadha Dushti or Annava Swadha diseases. In Annava Swadha disease, what all are the medicines we can suggest, and with the details. That is what discussed here. And one more question is describe Samprapti Katana, Chikitsa Sutra, Chikitsa Yojana, including Aushadha Yoga and Patyapatya, Parinama Shula, and Anandra Shula. So most of these questions can come as a piece. Again. So this is taken from the must to know points. So questions will be, most of the questions will be coming from MK points. MK points, I think you know about what is MK, what is DK, what is NK, and all those things. Must to know, desire to know, and nice to know. So there are different classifications of points are given. So most of the questions will be coming from must to know points, especially 10-mark questions comes only from the must to know points. So these are the way of asking questions in third paper. So I think, as I have discussed, Atmandya, Aruchi, and Rojaga is important for. Then Amla Pitta is Amla Pitta Chikitsa. You should be properly study Amla Pitta Chikitsa. Parinama Shula and Anandrava Shula. Both symptoms, difference between Parinama Shula and Anandrava Shula, and Samprapti Vikatana. How the Samprapti Vikatana is done. Then treatment options, Chikitsa Sutra, medicines. So all these things comes in every diseases. Sardi, Gulma, Grahani. These are the most important diseases in Annava Swadhas. Sardi, Gulma, and Grahani. Then, so what all are given in the reading is most important. You can expect some other MCQ questions from the other parts. Other than that, the other areas are not that much important. So for 10 marks and 5 marks, you can follow these areas where I have marked it in red. So these are the main points you can follow up with. Now we comes to Manava Roga or Manava Srodhas Dushti Vikaras. So Manava Srodhas, it out of 100, it carries only 10 marks. So Manava Srodhas was 16 marks and Manava Srodhas is 10 marks. So you can expect 2 5-mark question from this area, 2 5-mark question from this area. I don't think there will be long answer question will be asked from the Manava Srodhas. So, but most of the chances is for 2 5-mark questions. So first point is Manasika Vigara like Kama, Krodha, Lobha, Mada, Matsarya, Shogha, Paya, Dainya. These are called as Kevala Manasika Rogas or the Mano Rogas, which is developed only by Rajas and Tamas without the association of Vada Pitta Kapha. So this is known as Kevala Manasika Rogas. So this is the first point in syllabus. What is Kama, what is Kobha, what is Lobha, Mada, Matsarya, Shoga, Vaya, Dainya. There are definitions for each of these terms, and the treatment aspect. Treatment aspect mainly includes Sattva-Vijaya Chikitsa, Sattva-Vijayam Puna, Ahidebhyo, Arthebhyo, Manonigraha. So, and Jnana, Vijnana, Dhairya, Smriti, Samadhi. These are the different domains of Sattva-Vijaya. So that includes first point, but this is not that important point. Important point starts from Unmada, Apasmara. Unmada Roga is very, very important, the treatment part of Unmada. Apasmara, same, Apasmara, types of Apasmara, and Adatwa Abhinivesha. Adatwa Abhinivesha is one of the important point, which can be asked for 5 marks. Adatwa Abhinivesha is, we get the references from the Apasmara Chikitsa itself. Chaga Samhita, Apasmara Chikitsa, Adatwa Abhinivesha, what is the action of Adatwa Abhinivesha? It's a Mahagada, we all know that. Then Adatwa Abhinivesha Chikitsa is explained in the same verses of Charaga. You can get it. This is very simple treatment. Adatwa Abhinivesha Chikitsa, you can remember. Chittodega and Vishada. Chittodega, you will not get any much reference from the Samhitas. So in Chittodega, if it is asking for 5 marks, you can write generalized anxiety disorder related conditions. Chittodega is one of the psychological condition which is due to Rajas and Tamas, which is explained in Charasamhita Vimanasthana 6th chapter, 5th sloka. So in that you will get the reference of Chittodega. Other than that, there is no much references of Chittodega. So you can, if Chittodega is asked, you can go for writing generalized anxiety disorder. That comes in next point, generalized anxiety disorder. Chittodega is nothing but generalized anxiety disorder. And Vishada also you will get some of the references, but there is no much reference for Vishada. There is Vishada is explained in Vatajananatmaja Vikara, and you will get very minimal references regarding Vishada. Asiddhi Bhayat Karmasu Sadhu Apravarti Vishada. So there is one definition you get from Susruta Samhita, that is Vishada. Other than that, there is no much explanation. So you can, if Vishada is asked, you can remaining portions you can write from depression itself. Okay. Chittodega, if it is asking for 5 marks, you can just mention what is Chittodega, and even for Vishada, you can just mention Vishada, what is Vishada, where its references are there in Samhitas. Then you can go for writing modern aspect and treatment, but you can you should write treatment here based on the Ayurvedic principles. Okay. Then Nidra Vikaras, sleep disorders, very important, can be asked for 5 marks. Other than that, the somatoform mood disorders, Bhavodvega, you should remember all these terms. These are difficult to remember. Stress-induced disorder, Prityabalajanya Vikara, stress-induced disorders. So sometimes these terms can be asked in questions. We don't know. This depends on those who are framing the questions. So if they are following the same words of which is present in the syllabus, they may ask like Prityabalajanya Vigara. But this is not an important point. Prityabalajanya Vigara, stress-induced disorder, is not an important point. Kamonmada, psychosexual disorders, is also not an important point. Obsessive compulsive disorder is an important point. You can study the modern portions of obsessive compulsive disorder, its types, what is definition, types, what are the management techniques of obsessive compulsive disorder. You can study the modern portions, and obsessive compulsive disorders, even some of the Ayurvedic portions like Vata Mother treatment, you can follow in that. And personality and behavioral disorders, Vyaktitva Evam Sabhava Viparya. This is also not that much important point. Still, you can prepare for 2 or 3 marks in personality and behavioral disorders. Depression is very important. Medya Rasayana and Manoraga is very important. So depression, Manoavasada, if Manoavasada questions comes, you should write about depression. Definition of depression, diagnostic features of depression, what are the clinical features, and ICD related clinical features. You can write symptoms and treatment aspect. Okay, treatment aspect you can write both modern and Ayurvedic portions. Maybe Rasayana and Manoraga, always it comes in Rasayana portion also. So here also you can write what are the Medya Rasayanas and how these helps, what are the action of Medya Rasayana in different aspects. You can see some of the research studies, and based on that also you can write Medya Rasayana details, especially in different conditions, how the Medya Rasayana act. So that is about Manova Srodha Dushti Vikaras, carries 10 marks. Some of the questions, model questions, summarize the Chikitsa Sutra of Manova Srodha Dushti and explain Samprapti Vighadana, Chikitsa Sutra and Chikitsa of Unmadaroga. This is an expectable question. Summarize the Chikitsa Sutra of Manova Srodha Dushti, explain Samprapti Vighadana, Chikitsa Sutra and Chikitsa of Unmadaroga. Okay. So here, you should know the Samprapti. Whenever the Samprapti Vighadana is asked, you should first frame the Samprapti, then only you can go for Samprapti Vighadana. So you can write the classical Samprapti, or you can make a related Samprapti, then go for Samprapti Vikadana. Then another question is explain Samprapti Vikadana, Chikitsa Sutra and Chikitsa of Abhasmara Roga. Okay. Abhasmara Roga Chikitsa. The slokas even for Unmada Chikitsa Sutra, Abhasmara Chikitsa Sutra. I think you all have heard the Chikitsa Sutras. So this is important. Okay. Then another third question is outline the Samprapti Vikadana, Chikitsa Sutra and Chikitsa of Adattvapanivesha Roga, Chittodvega and Vishnu. These three questions are most important. Outline the Samprapti Vikadana, Chikitsa Sutra and Chikitsa of Adattvapanivesha Roga. Adattvapanivesha Chikitsa Sutra, it's there. If possible, you should study the Chikitsa Sutra. It starts from Snehana Svedana and Shodhana, then Nitya Rasayana Prayogas, then Sattva Chikitsa. That's the order of Adattvapanivesha Chikitsa. Then Chittodvega and Vishada. Okay. So these three questions are most important. Then review the etiopathogenesis, diagnosis and management of Chinda Roga, that is generalized anxiety disorder. So as I told, you should prepare generalized anxiety disorder for at least for three months. What are its symptoms? How the assessment of generalized anxiety is done? And the generalized anxiety symptoms have both psychological as well as physical symptoms. You should not show psychological as well as physical symptoms. The other one is etiopathogenesis, diagnosis and management of Vishada, depression. So this is important. Even depression can also be asked for 5 marks. So you should minimum you should prepare for 3 marks so that you can extend up to 5 marks. Then state the Ekala Aushadha Prayoga, Aushadha Kalpa, Rasayana in Manasika Roga. This can be asked. Ekala is single drug therapies and administration of single drug with its dose and Anupana and all those things. So you should know for every disease, you should know minimum of 10 formulations and some single drugs. And what is Matra, what is its Anupana, all those things. And Rasayanas in Manas program. So every slogas you will get questions like the Aushadha Prayogas. You can get the questions like Aushadha Prayogas. So while writing disease, you should know minimum 10 medicines related with that particular condition or particular slogas. And the last one is discuss the clinical understanding of Adattvapanivesha, that is obsessive compulsive disorder, neurotic disorders, and Vyaktittva evam Swabhavi Parya. This is not that much important. Still, you can see that personality and behavioral disorders, there are different grouping of personality and behavioral disorders have been done. So you can just see the names, what all are the clusters, different clusters of personality disorders have been mentioned. You can see the names and main symptoms of each cluster, what all are the personality disorder comes under every cluster, and what is its major symptoms. And treatment aspect. Treatment aspect is almost similar. Psychological treatment is almost similar for all the conditions related to psychological. Depression, mood disorder, or obsessive compulsive disorder. Almost CBT, cognitive behavioral therapy, or different psychological methods are there. You can just remember that names. Other than that, so as far as my knowledge, you should mainly concentrate on Unmada Roga, Apasmara Roga, and Adattvapanivesha, Vishada. These are the areas and some of the medicines of Manohara Slokas. Krishna, am I clear? Is it audible properly?
It's audible. It's audible for me. Students, audible?
Anybody can just share me.
Yeah.
Is it clear what I am telling?
It's clear. You can continue.
Next, third portion is Antasravi Grandhi Vyadis, that is endocrinal disorders. Endocrine disorders is also have turn marks. So see, this is same like of Manasika Roga. There can be turn marks. Questions can be asked from endocrine disorders. So here also you can be specific to some points where it's like there is only little points are given in endocrine disorders, but it carries 10 marks. So you can Avadu Grandi, that is nothing but the thyroid gland, and thyroid gland related disorders like hypothyroidism and hyperthyroidism is very important. You should know how it is diagnosed, what are the features of hyper and hypothyroidism, and what are the different management methods as per modern. So here you cannot write too much of things. If hypothyroidism asked or hypothyroidism asked, you cannot write too much of Ayurvedic or classic preferences. You should write the modern portions. And after writing modern concepts or disease related things, you can mention these how it is understood in Ayurveda. So you can see that most of the hypothyroidism conditions are related with the Rasavasrodhodushti vikaras. The Rasavasrodha, direct involvement of Rasavasrodhas is there. So it's like all the Rasavasrodhodushti lakshanas are available in hypothyroidism. And when we go for hyperthyroidism, most of the time this is related with, I'm not telling it's correlated, or it's related with Bhasmaga Roga or Atyalni conditions. Okay. Both are having different opposite symptoms almost. So that is hyperthyroidism, and you should know the values of T3, T4, TSH, and the importance of T3, T4, and all those things. Just to diagnose that. And supplementation and the negative and positive feedback mechanism. Just these all things, everybody know all these things, how the feedback mechanism happens, and what is the role of TSH, what is T3 does, what T3 and T4 does, all these things. Then parathyroid disorders. So you just remember the words. Pravara Avatuga Granthi Vyadhis. Even for teachers also it's difficult to pronounce all these things. Pravara Avatuga Granthi Vyadhis, that is parathyroid disorders, hypoparathyroidism and hyperparathyroidism. Just prepare for 2-3 marks. Maximum it can be asked for 5 marks. And here also you may not get any long answer questions from endocrine portion also. It carries only 10 marks. So there is less chance to get total 10 marks question from this area. Then pituitary disorders, important. Pituitary disorders are very important. We can see what are the pituitary hormones, posterior pituitary, anterior pituitary, and what are the different pathologies of pituitary happens. So hypopituitarism. Here some of the examples are given, but you just study it properly. Here dwarfism and gigantism, just like growth hormone pathologies, Adidirgha, acromegaly, all those things. Growth hormone pathologies are mainly mentioned in pituitary glands, under pituitary glands. But you can see what are the hyperpituitarism conditions, hyperpituitary conditions in a general way. So that can be expected. Next is Udagameha, that is diabetes insipidus. Again, you can see that how the pathology happens, diabetes insipidus, and what are the symptoms. If any correlation is possible with Ayurveda, there are different meha, or there is a condition called Mutradisara. If it is possible, you can write the diagnosis of correlations. Otherwise, you can just write the modern portions and how it is treated. Then adrenal gland disorders, Adivritta Grandhi Vikara, adrenal gland disorders. So here also some of the hyperaldosteronism, hypoaldosteronism, Addison disease, Cushing disorders. Just see what all these things are, and just see how these things diagnosed and what are the symptoms. Only Addison disease and Cushing disorders are given in syllabus, and hyperaldosteronism or hypoaldosteronism. This adrenal gland is not that much important. So what I feel is you can mainly concentrate on thyroid, parathyroid, and pituitary. Mainly parathyroid and pituitary. Parathyroid and Uttakameha is also there's a chance. So this is from endocrinal portions. Expected questions. Explain sigils of Manda Vaduga. That is hypothyroidism. Next is hypothyroidism treatment portions. Describe sigils of Tivra Avaduga, that is hyperthyroidism. So this just remember these terms. And explain sigils of Adivrika Grandhi Vikara, adrenal gland disorders like hyperaldosteronism, Addison, Cushing disorders, all these things. Then discuss sigils of Piyusha Grandhi Vikara, pituitary disorders, hypopituitarism. So you may not be able to write all the Ayurvedic treatment for all these things. So you can, if these all are clearly or purely modern portions, modern concepts should be written, and you can give importance for the modern treatment itself based on the pathology. Then, if you know any of the Ayurveda medicines, particularly given in such conditions, you can write that. Otherwise, mainly the question, those who are framing question are expecting the modern portions properly. Then explain Piyusha Grandhi Vigara, already I told pituitary disorders, hyperpituitarism and hypopituitarism. Uddhagameha, diabetes insipidus, that is also comes under pituitary disorders, diabetes, you know, the hormonal vasopressin and all those things. Hypoparathyroidism, hyperparathyroidism. Just see these things, what all are the things. That is about endocrine conditions. Next is Vyadik Shamatva Vigara, immunological conditions, different immunodeficiency disease conditions. So you can expect a 5-mark question from this area. Like it includes immunodeficiency diseases, primary and secondary immunodeficiency disorders. Then Atma Pradhirodha Kshamatva Vigara. Atma Pradhirodha Kshamatva Vigara is nothing but autoimmune conditions. Different autoimmune conditions. You can write what is autoimmune disorders, what are the different types of autoimmune diseases and all those things. Systemic SLE, systemic lupus erythematosus. So that is Pradirakshaja. Pradirakshaja. It's given as Pradirakshaja. Ankylosing spondylitis is important. So you just see the words, you just remember what it is actually. Most of the time, the English term will be given in bracket in questions. So systemic SLE in autoimmune disorders, SLE, ankylosing spondylitis, MS, that is multiple sclerosis, rheumatoid arthritis, are important. So you should just go through all these pathologies. Ankylosing spondylitis, especially, these have a variety of HLA-B27 positive varieties. These are the different laboratory investigations for diagnosing all these things. Multiple sclerosis. What is the pathology of multiple sclerosis? Rheumatoid arthritis, how it is diagnosed, what are the exact pathology. So you should know the pathology, symptoms, and management methods. So here also, the most importantly, modern descriptions are mainly expected. If you can correlate with proper Ayurveda understanding, or you can make concepts of Ayurveda. So it's given that Amavada is rheumatoid arthritis, but Amavada is always not rheumatoid arthritis. Amavada can be different various conditions. So you should not write always rheumatoid arthritis is Amavada. That is a wrong concept. That's a wrong understanding. Rheumatoid arthritis can be different conditions. Sometimes even rheumatoid arthritis presentation will be having other extra presentations. So that is depend on patients. Then hypersensitivity reactions, you can see what it is. So only 5 marks, 5 mark question you can expect from this. Otherwise, the remaining 3 marks are mostly asked as MCQs. So just see what is immunodeficiency disorders and primary and secondary immunodeficiency conditions. Autoimmune disease. What are the autoimmune diseases? These are the main 2 areas where you can expect a 5-mark question. So some of the questions like describe the etiopathogenesis, diagnosis, and Ayurvedic management of Vyadhishamatha Heenajanya Vikara, immunodeficiency diseases, primary and secondary immunodeficiency disorders. So you should write what is immunodeficiency conditions. Within that, what is primary and what is secondary. Okay. Then Ayurvedic management. Ayurvedic management, you can write from your side based on your see. In such questions, mainly students' logics are assessed, how they approach these conditions through Ayurveda. You can write it that as a Rasavaha pathologies, or the Vyadhishamatha pathology, or Dhatu Balakshayajanya. So you can correlate with different conditions, Agni Kshayajanya Vikaras, Agni Mandajanya Vikaras, chronic Amajanya Vikaras. So all these conditions can be correlated with autoimmune conditions. You can formulate your own treatment methods, but it should be logical, starting from Dipanapachana, Rekta Shodhaka, then Dhatu Pushtikara, Rasayana, all such line of treatment you can adopt in every immunomodulatory conditions. Another question, explain the etiopathogenesis, diagnosis, and principles of management of Atma Pratidrodha Kshamatha-janya Vikara, that is nothing but autoimmune disorders. So write different autoimmune disorders, what it means actually. Then different condition based on avastha, you can write treatment. So mainly go for modern management initially, then write Ayurvedic treatment options. So everywhere you can write these Shodhana Shamana Chikitsa. Whenever patient is having Uttama Bala and patient is having Bahudosha Avastha, you should go for Shodhana. Even whatever the condition is, you should go for Shodhana. Otherwise, if patient is Alpa Bala and Roga is Alpa Bala, you can go for Dipanapachana, Mahara, or Dhatu Bala Pushtikara, or Dhatu Agni Dipana. So all these conditions you can write with some examples of medicines. Then systemic lupus, SLE conditions, systemic lupus erythematosus. What are the exact pathology of SLE conditions? So some of the symptoms are related with Vadarakta pathologies. So here there also you can write some of the Vadarakta treatment aspects. SLE. Mainly most of the clinicians treat SLE based on Vadarakta pathology. Then hypersensitivity reactions. This is called as Adisamvedana Shilada Janya Vyati. Hypersensitivity reactions. So different allergy conditions are comes in hypersensitivity reactions. And some of the musculoskeletal conditions, ankylosing spondylitis, multiple sclerosis, Crohn's disease is gastrointestinal, rheumatoid arthritis. All are comes under autoimmune conditions. So how we can see it from the Ayurvedic point of view and plan a treatment. So you can write your own treatment here. Nobody will without any this thing. Nobody will cut your answers. You can logically prescribe if it is properly. If you are understanding the pathology, you can logically write the Ayurvedic pathology here, Ayurvedic medicines here. So mainly concentrate on Rasavas for this, Vyadhishamatha, Rasayana areas, and such things you can focus on this and you can write your own treatment methods. Shukravas for this, 8 marks again. Main portions are Clipe and Shukradosha. Other portions are there, Shukkalpada, Kshina Shukra, Dojapanga, Pupaurusha, male hypogonadism, Nabumsagatta, importance, that is Vanditva. So among these, the main, most important is Clive and Shukradosha. So there are different types of Clive as per Charaga and Charaga. There are 4 types of Clive. Again, Susada, there are 6 types of Clive. And Clive Chikitsa. This is explained in Charaga Sutrasthana, Charaga Samhita Chikitsasthana, 30th chapter. So you will be getting detailed clive chikitsa there, and Susruta also explain different types of clive. Yeah? So even the same clive chikitsa you can write in Vanditya also. If Vanditya infertility, male infertility is asked, you can write the same clive chikitsa. So almost the treatment of Vanditya and clive is same. There is no particular separate treatment is told for Vanditya. And Shukra doshas are important. Ashta Shukra doshas by Charaga and Susruta. There are 8 types of Shukra doshas. And Shukra dosha chikitsa is also important. So these are the 2 areas where you can expect 5 marks question from Shukravas authors. And other male hypogonadism, you should know what is hypogonadism. Different testicular pathology or testicular failures. You should know that how the hypogonadism can happen and what are the hormonal pathologies happen in male hypogonadism at testosterone level. So that is another point. Mainly you can focus on clivia, Shukradosha, and male hypogonadism. Okay. So remaining 3 marks can be asked as MCQs like what if sperms are absent in semen, what it is called. So there is some terms like azoospermia. Okay, azoospermia is there is no sperms in semen. Or what is aspermia? Aspermia is there is absence of semen. Not aspermia. It's not meaning that it's there is no sperm in semen. Actually, aspermia is absence of semen itself. There is no ejaculation, that is called aspermia. So such condition or what is asthenospermia, different conditions are there. You can just, it can come for MCQs and all those things. And other portions, Kshina Shukra, Dojabanga, these points are not that important. You can avoid such areas. Then expected questions. Describe the Samprapti Vigadana, Chikitsa Sutra, Chikitsa Clivia, and Shukra Alpada. So, Alpa Shukrajanya Clivia is one of the type of Clivia itself. Alpa Shukra. Shukra Alpajanya Clivia is the type of Clivia. So, it comes under Shukra Alpada is also comes under Clivia itself. You can properly study the Clivia Chikitsa and write. Shukra doshas, Ashta Shukra doshas, Ashta Shukra dosha or Ashta Shukra dushti, you should know. Second question, elaborate the Samprapti Vigadana, Chikitsa Sutra, and sequence of Shukra dosha and Shema Shukra. Shema Shukra is the type of Shukra dosha itself. So, Shukra dushti treatment covers all these things. And another one question that is not that much chance is there. Detail the Samprapti Vigadana, Chikitsa Sutra, Chikitsa of Dojamanga, and explain the cause of impotency and plan the treatment. Not that important. Then determine the pathogenesis, diagnosis principles of management, and Ayurveda perspective in the treatment of male hypogonadism and infertility. This is also nice to know point, not a major point. So less chance. State the Phalasruti, Matra, Anupana, and Sevana Kala of after the yoga and Shukravasvata Vikara. Not that important. This is also not an MK point. Still, you should know some of the medicines that can be given in Shukravasvatas as single drugs as well as combination formulations. So every Swadas, whenever you are studying each Swadas, you should know some of the medicines with Phalasruti, with Anupana, with Matra. For every Swadas, you should note down medicines. And now we are going for Guhya Rogas, Tirangopadamsha, syphilis, gonorrhea. So Tirangopadamsha are Ayurvedic portions, syphilis and gonorrhea modern portions you should know. Then there is one point called lymphoma granuloma inguinale. Okay. Lymphoma granuloma inguinale, not that important. You should just know what it is. Just see the definitions, what it's the features of that, how it happens. So that's all. And soft chambroid is given, that is given as Piranga Vrana. soft changroid. So you should know what is changroid. Other than that, just see what is the general management, and Visarpa, herpes simplex, not that important. So you should mainly focus. This is also 8 marks, carries 8 marks. Bukhiroga also carries 8 marks. So you should mainly focus on Piranga and Ubadamsha. From Ayurvedic point, what are the treatment of Piranga Ubadamsha? Then modern topics, syphilis and gonorrhea. What is it's how the pathology happens? What are the main characteristic features? How the spreading of disease, all these things, and diagnostic features, laboratory investigations, then management. Okay, 8 marks. Expected question: describe the Samprapti Vikatana, Chikitsa, and Aushadha Yoga of Ubadamsha, Piranga, both Ubadamsha and Piranga. And Puyameha is gonorrhea, so you can just see what is Puyameha also. So syphilis and gonorrhea, of course, you should know the modern pathology. That is the only important portion. Now we'll go for Vajikarana management. Vajikarana carries 12 marks. So this is little bit important points. Vajikarana. I have done a YouTube video on Vajikarana. You can just go to YouTube and share Vajikarana MCASM third prop. You can see, you can search it and it will come. So there is 2 sessions I have done on Vajikarana Chikitsa. So the total video of almost 2 hours. It's available in YouTube. You can see that it covers all the Vajikarana portions, Vajikarana yoga, what actually Vajikarana means. So you will get all the details of Vajikarana in that 2 videos. So what is the principal benefits and need of Vajikarana? Then Shuddha Shukra Lakshanas, Vajikarana Dravya and Shukrava Swadodushti Vikara, Vajikarana Dravya and Klaivya, Shandatva, Halasudhi, Sevanakala, Matra, Anupana of various Vajikarana yogas. This is very important. You should know various Vajikarana yogas. So there are 4 chapters, 4 padas of chapters are explained in Charaka Chikitsa Sana Vajikarana. So in every chapter, there are almost 8 to 10 yogas are given. So you should know 5 to 6 Vajikarana yoga. It's actual indication, Anupana, and some of the medicinal preparations like Siddha Magaradvaja, the Kamri with Ravanarasa. So there are some medicines. It will be available in your books. You should know the name of this medicine, Vajikarana yogas. Okay. So first one is principle and benefit need of Vajikarana. That is most important. What is Vajikarana? You should write the definition of Vajikarana by Susruta. Vajikarana Tantram Nama Alpa Dushta Shushka Vedasa. So all the definitions of Vajikarana, what it actually means. It's not only a sexual medicine. This is meant for actually proper productive progeny, creating a productive progeny. So you should write all these things. And what is the importance of female sexual partner in Vajikarana? Everything is you can see in all these Vajikarana aspects. So some of the expected questions are: recall the principles of Vajikarana and summarize its need along with the benefit. So these can be asked. You can expect a 10 marks question as well as a 5 mark question. 2 5 mark question can be expected. If not single 10 mark question, 2 5 mark question can be expected. So recall the principles of Vajikarana and summarize the need along with the benefit. So you should know what is Vajikarana, what is its importance. This is what exactly Vajikarana is other than male sexual medicine or that increases sexual gear. So you can go to that videos. Then the concept of Shuddha Shukra and analyze the role of male infertility and reproductive health. Elaborate the role of Vajikarana in the management of infertility and impotency. So these things. And classify the Valaswati, Sevanakala, Matra, Anupana of the Aushadha Kalpanas. like Siddha Maharadvaja, Jati Paladivati, Amrita Vallataka, Vajikarana Gruda, Vrishya Gruda, Vrishya Butiga, Sri Gopala Taila. So these things you can see. If possible, I'll share the links to Dr. Krishna. You can get the links of the videos. And most important part of this third paper is Rasayana. We come to Rasayana, carries 20 marks. So you can expect 110 mark question. There will be short 110 mark question from Rasayana. And you can expect another 5 marks 2 questions from Rasayana. So it includes all the points under Rasayana, very important. Principles and indications of dosage of Rasayana according to the age. Acharya Rasayana in clinical practice. Evidence-based Rasayana, important. Then Naimitika Rasayana, Medhya Rasayana, within Naimitika Rasayana, Medhya, Kandya, Varni Rasayana, Kesha Rasayana. Then how these Rasayana medicines act? Chikitsa, Karmogatva, Matra, Sevanakala, Anupana of various Vyadhihara Rasayanas. Okay. So 20 marks should be expected and 110 mark question always will be there. So one of the most important point for 10 marks is elaborate the application and benefit of Naimitika Rasayana with examples. This is the only must-know point given in Rasayana. Elaborate the application and benefit of Naimitika Rasayana with examples. This is the only must-know point given in Rasayana. So 10 mark question will be asked from must-know point. So that is Naimitika Rasayana. So you should be thorough about Naimitika Rasayana and application and benefit. So only from this point, a 10 mark question will be asked. Then for 5 mark questions, elaborate various Vyadhihara Rasayana according to its Chikitsa Karmagata, Matra, Aushadha Sevana Kala, Anupana. So you know different various Vyadhihara Rasayanas, Chilajita Rasayana, Leshna Rasayana, Tavar Rasayana, Tripala, Chavanpra, Shadya, Kastya, Ridri, Kushman Rasayana. There are a lot of Vyadhihara Rasayanas which does both Vyadhihara and Rasayana streams. Okay. So these names you should remember. What are its most important points? Also, you should remember all these things. So can be asked for 5 marks. Then retrieve the indications, type, importance of Rasayana. So types of Rasayana is important. You should know what are the types of Rasayana, like Kudipraveshika Rasayana, different types of Naimitika Rasayana. Rasayana. All these types is very important. What exactly Rasayana means for? So you can refer Charaka Samhita first chapter, Steel Sasana first chapter for Rasayana definition and types of Rasayana, all those things. Okay, then different Kandya Rasayana, Medhya Rasayana, all these things are from Ashtanga Hridaya. Once you go and just see the Ashtanga Hridaya Rasayana here also. Then Acharya Rasayana, this is from Charaka Samhita, first chapter, 4th Pada, Acharya Rasayana. I think you all might have studied Acharya Rasayana by heart of the sloga. So how it can be clinically practiced? Can be asked as a practically based question. And the last aspect, last point in third paper is Jarajanya Vikara, that is senile disorders, Inthirapadosha Vikaras. So it includes a lot of Jarajanya geriatric disorders. So you know that old age disorders, what are the old age disorders? Different psychological conditions, different musculoskeletal conditions like osteoarthritis, depression, psychological dementia, Alzheimer's. There are many diseases, geriatric conditions, even Parkinson's disease. So you should mention all these diseases under geriatric conditions and how these conditions are mainly managed as per Ayurveda. So mainly Vada Pradhana conditions, you can write Vadahara Chikitsa or Vada Vyadhihara Chikitsa in almost all the diseases. Then one of the important condition is Smriti Lopa. Sensory and cranial nerve disorders are not that important. Smriti Lopa, Alzheimer's can be asked for 5 months. So what is Alzheimer's? dementia, all these things you should know. So expected questions: explain Samprapti Vikatana, Samanit Kilsa, Jarajanya Vigara, and Indra Vigara. Okay. Mainly senile disorders, senile conditions, Jarajanya Vigara. And Alzheimer's disease. Review the etiopathogenesis, diagnosis, and principle of management of Smriti Loba, that is Alzheimer's disease. So these are the two main points. So you can just see here how the marks are distributed in third paper. So Chikilsa of Annamahas Swadhashtivigara, 16 marks. You can expect MCQ short answer question as well as long answer questions from first point, that is Annamahas Swadhashti. Then Manova Swadhashtivikaras, 10 marks. You can expect MCQ, you can expect short answer, you can expect long answer. And Chikilsa of endocrine disorders on the Slavi Grandi, 10 marks. You can expect MCQ or 2 SAQ or 1 long answer. Okay. Vyadhishamatva Vigara, 8 marks. So you cannot expect any long answer question from Vyadhishamatva Vigara. You can expect 1 5-mark question and another 3 marks MCQ. Chikilsa of Shukra Vahaswada Vikara, 8 marks. So there will not be any long answer questions. You can expect a 5-mark question and then 3 MCQs. Chikilsa of Mukhiroga, again 8 marks. So again, here also will not be having any long answer questions. In Vachikarana, it's having a weightage of 12 marks. So all the MCQ, SCQ, LAQ can be counted. And Rasayana is 20 marks. So of course there will be a long answer question from Rasayana. There can be 2 long answer questions also. Most probably 1 long answer questions and 2 5-mark questions from Rasayana. So properly study the Rasayana. The first important area is Rasayana, second is Annavasodas, then Vachikarana. So if you study only Rasayana, Annavasodas and Vachikarana, that itself carry 36 marks. Okay. The last one is Jarajanya Vigara, again 8 marks. So you can expect a short answer and 3 other MCQs. So as I told earlier, MCQ can be expected from all the points, even must to know points, desirable to know point, and nice to know point. SAQ, you can expect majority of the SAQ shall be drawn from the must to know point of the syllabus. So in syllabus description, you can see what are the must to know points, what are the DK points, what are the NK points. Okay. So SAQs, short 5-mark question will be, most of the question will be come from must to know points. And questions from desirable to know part is part of the syllabus shall not exceed 1, only 1 question. For every syllabus point, that is, if this was, you can expect only 1 question from, maximum 1 question from desirable to know point. No question shall be drawn from nice to know point. No question shall be drawn from the nice to know part of syllabus. So no 5-mark question will be there. It's not complete sentence. So no long answer questions. No long answer questions will be there, I think. And all long answer questions shall be drawn exclusively from must to know point part of syllabus. So there will not be any long answer question from desire to know or nice to know points. No question shall be taken from desire to know or nice to know part. Number of LAQ should not exceed 1 per topic unless maximum mark exceed 20. If the marks exceed 20, you can expect 2 10-mark questions. Otherwise, there will be only 1 10-mark question from 1 syllabus point. So these are the explanations about third paper. If you have any queries, we'll have a discussion.
Yeah. Thank you, Dr. Ayushla. There's few queries are there. First is, sir, how to answer the Samprapti Vigadanath questions?
So who asked that? Anybody? Can anybody tell that whether it is taken in your UG classes? I think there is. It's not available in textbooks also. Is there? Is it available in textbooks? Krishna, you can see this.
Yeah, I can see the
slide
pictures.
of Samprapti Vigadana.
Yeah, 8th point. Yeah, you should just expand the slide.
Yeah. Just 1 second.
Until then, I can go to second question.
Yeah, it's okay.
Sir, is it correct? Hyperaldosteronism is associated with adenosine disease. Shouldn't it be?
It's not like hyperaldosteronism, adenosine disease. All are different pathology. There is some mistake in syllabus. So you study it as hyperaldosteronism or hypoaldosteronism. Both are different pathology. Or you can study it as Addison or Cushing disorders. Both are having different pathology. So one is related with corticosteroids, that adrenal gland, cortex of the adrenal glands, one of the most important parts. So there is some mistake in syllabus. You don't see all these things. Just adrenal disorders mainly. You can see hyperaldosteronism. What is hyperaldosteronism? What is hypoaldosteronism? Then what is Cushing? What is Addison? But you just see these 4 points. So Addison or Addison disorder, or that point itself is not that important point. So just you see what are the pathologies happening in these 4 conditions. That is enough.
And next question is, sir, Naimatik Rasayana is not sufficient given in KC book for 10 marks question.
See, you can see Naimatika Rasayanas from different previous books also. Don't go for only the new books. New books are not given properly. I think you can search in previous books also, in previous syllabus books also. You'll get proper. So in Naimatika Rasayana, you just don't write only Naimatika Rasayana points. You can generally write what is Rasayana and what are the types of Rasayana, and then go for Naimatika Rasayana portions. Okay. So whenever you are writing for 10 marks, you follow this method. So write the Rasayana, importance of Rasayana, types of Rasayana, and all those things. Then last you can name the Rasayana, so the Naimatika Rasayana. So there is 10 marks. This Naimatika Rasayana, the question is almost short question. So you can refer the previous books also.
Another question, sir. Sir, if point having in MK but also belongs to NHPL or NHLT, then also probably to ask?
Not really. Not really. So that are the practicals to be done in classrooms as a part of activities. You can expect the questions only from the LH portions. LH portions. LH portions are not really. It's not actually. This is not clearly taught in the syllabus also. I don't think there will be questions from LH portions. You can just focus on LH portion.
Another question, sir. So what about Rasayana Vajikarna yogas? How to study them? Is it compulsory to by heart ingredients also?
Not compulsory to by heart the ingredients, but there are some small Rasayana Vajikarna yogas. So if you are going to write the long Rasayana yogas like Chyanuprasha and all those things that contains a lot of ingredients, so even you cannot write at all. So in such conditions, you just see the name, what is the indication, what is the dose, what is the Anupana, that is enough. No need of writing all the ingredients and all those. There are some Vajjikarana yogas which contains only 3 medicines or 4 medicines. So you can study that ingredients and the name also. So Vajjikarana yogas, I have given it in my videos. I'll share that YouTube video link. And Rasayana yogas also, you can even single Rasayanas, you get Chiladi Rasayana, you get Gokshu Rasayana, you get Tila Rasayana. So in these all are the single Rasayana therapy. You get Chitra Rasayana or Tuvaraka Rasayana. These are the single drugs. So there is no much point in writing ingredients and all those. You can just write the dose. What are the conditions indicated for all these rasayanas and how it is administered. In that area, you can concentrate. That is the then Trivula Rasayana is there, only 3 ingredients are there. So, which is easy to study, you can study such Rasayanas, but the indication should be proper and the method of administration and Anupana should be proper. I think I can explain how the Samrati Vikadana can be done. So, here I have taken Mutra Ghada as an example. So first, these format you can follow. So first you can write the Nirukti. You don't copy this. This is an AI generated one. So you can write the Nirukti, then definition of the disease, particular disease. So if Mutragada is asked, then what is Mutragada? Mutrasya Khada Varoda Mutragada. You can write this Nirukti and definition. What is the definition of the disease? Then where the references are available. Yeah, from Sudha, from Ashtanga, from Charaga, where actually this condition is mentioned. So you can just write the references. Then Nidana, what are the exact or main Nidana? 3-4 Nidanas you can write that mainly contributing the disease. Then types. So this is a format I am giving. Whenever there are some Samrapti Vikadana or such kind of questions, most of the questions are mainly based on Samrapti Vikadana, especially in third paper. So, as a 5th point, you can write the types. So different Mutragadas are there. 13 Mutragadas are there. You need not write all the 13 types of Mutragada. You will not get that much time. So you can write that there is 13 types, or according to Ashtanga Hridaya, there is 20 types you can write. Then you can mention some of the types of Mutragada. Then most important one is after types, you can write the Samprapti. How the Mutragada Samprapti. Whenever Samprapti Vikadana treatment is asked, you first write the Samprapti. So here Vada Prakopa, you can see first start from Nidana. There is particular Nidana contributing. For example, if you consider Mutragada, there is Aharaja Nidana, Viharaja Nidana, or like the Vegadharana or particular Ahar Sevana, Vada Prakopa, Ahar Sevana. You can mention what are the Nidanas. Or Vada Vruddhikara Viharas. Then, especially, Atmivandi happens, there is Vishamatmi, Vada Vaigunya happens. Then, this Vada Vaigunya, especially related with Apana Vaigunya, this Apana Desha, Mutravasvata, Sangha, or Basti goes to Basti, Stana Samshaya to Basti, and causes Sangha, Mutravasvatas, and leads to obstruction, Avrodha. Then leads to Mutra Khada. This is a simple pathology, a simple Samprapti. If you get time, you can write Samprapti Kadaga. Otherwise, Samprapti Kadagas are not that important. You can just write main important dosha. See what is the main important dosha? That is Vata. Dosha is Dasa, Rektan, Mutra. And Srotas is Mutrava Srotas. Srota Dushti Sangha. Agni is Vishamagni. Udvasthana is Meli Pupashya. Vektasthana is Basti and Mutrava Srotas. Srogamaka is Madhyana. Okay. So you can write Samrapti, then Samrapti Vikadana. Okay. Only after framing the Samrapti, you can go for Samrapti Vikadana. Otherwise, there will not be Samrapti Vikadana possible. Okay. So Nidana Parivartana. Whatever the Nidanas you've seen in that particular patient, you have to tell the patient to stop all Nidanas. If Vegadharana is there, then avoid Vegadharana. if there is some guru abhishanti ahara sevana, then stop that. If there is ruksha, asnigdha or ruksha lekhu, such kind of ahara sevana, and other vada prabhavajanya viharas, you can stop the fish. So mention nidana parivardhana, and just you can mention 3-4 nidana. You have to avoid all those nidanas. You tell the patient. So starting from the nidana parivardhana itself, we are breaking the samprapti. So breaking samprapti is nothing but the treatment. So first we do the nidana parivardhana. Then so Agni is affected here. अग्नि को ठीक करना है. सो निदान के वजह से अग्नि खराब हो गया और what अग्नि got the problem, it becomes विषावाग्नि. So normal दीपन बाधना और अग्नि संदूषण medicines. So दीपन बाधना medicine you can write there. If Ama is present, Amavastha is there, then of course go for dipana badana conditions. Different dipana badana medicines we can prescribe. So under Agni Samigarana or Agni Vardhana, you can write 3-4 dipana badana medicines. Then next one is Srodadushti at the level of Mutra. Okay. So Sroda Shodhana is the for Srodadushti, Sroda Shodhana is the treatment. So what is happening to Samprapti, you have to write exactly correction of that samprapti. So Sroda Shodhana should be given. So Sroda Shodhana ke liye, for Sroda Shodhana you can write 3-4 medicine. Bhratyadi Kashaya, you can write Vitaryadi Kashaya, or you can write Aranadi Kashaya or other Trinabanjamuladi Kashaya. Such condition for Sroda Shodhana or Mutra Shodhana, you can consider these things. Or otherwise, if Dosha condition, patient can undergo Shodhana therapies like Vamana. If Vamana is addressed, Vamana can be done. Vidadana is addressed, Vidadana can be done in such way. Then Dosha Shamana, Vada is the male dosha. So Vada Anulomana, Vada Pradhana Dosha Shamana, Vada Anulomana treatment. So Vada Anulomana, you can go for some Snigdha Virejana or Avagaha Seda, localized Seda, Ampinda, Bhajitigilsa. You can do all these things under Vada Anulomana. So first you write Vada Anulomana is the next line of Samprapti Vivarana. For that, these things we can give it. Then Mutra Virejana, next Mutra Avrodha is there. So next we have to release the Mutra. So for that Mutra Virejana also does. Again, Bhratyadi, Gokshura, Punarnava, such Punarnavadi Kashaya, Gokshuradi conditions. You can give such medicines in that condition. Then at last, Vasti Shodhana or Rasayana Chikitsa. So you can consider Gokshura Rasayana, all those things, or Silaju Rasayana. And so here, whatever condition, whatever the medicines you know, all Rasayana conditions you can write. So this is the way of writing Samprapti Vikatana. After Samprapti Vikatana, you can go for Chikitsa Sutra. The main Chikitsa Sutra, Chikitsa Yodhana. Chikitsa Yodhana, in the sense, what is exactly told in Samhita, Snehana, Sedana, Dipana Vajana, Padanalomana. So already we have mentioned that, but in little bit detail you can write here. Astavanavasti, then if Astavanavasti is indicated, how the Astavanavasti is given. If Anavasanavasti is indicated, how it is given. Uttaravasti is indicated, how it is given. So main medicines, then Silsa Yojana, Aushadha Yogas. What are the main Aushadha Yoga? Bhukshuradi, Guru, Chandrabhavadi, Varnadi Kashaya, Pranavadi Kashaya, Yavastara, Chilajatu. Then at last, conclude with Patyavatya. So this is a way of writing for 10 marks. And you can conclude. So you can construct this into 5 marks also. You can make shorter and make it for 5 marks also. So this is the way of explaining Samprapti.
And another question is, sir, will they give both Ayurvedic name and modern name, for example?
Most probably we don't actually, but still most probably they will be giving both Ayurveda and modern names. Otherwise, only modern names. So it will be easy for you. I don't think they ask these kind of newly formed Ayurvedic terms.
Yes, sir. Thank you for your precious time for our students, sir. Thanks so much. And I thought students are get valuable things from your side for the examination. They think they will follow your advices and they will read. And students, we will give the PPT, that recording to your, we will put in the group. So please be in the group. Within 2 days, we will put all the recordings. And final question: can say a few topics for 10 marks on R6S batch, for R6S batch.
What is that? R6?
Batch, the examination, they are giving the number now, RS5, RS3, R6S batch, something is like that.
10 marks question, especially from this area, KC you want? Third paper of KC?
A few from marks, that's why they asked. You can say a few questions for 10 marks from R6S batch, that's all. They didn't mention any of the...
See, here I already told what are the questions. Already told what are the areas you can
so
expect.
I think it will be given in the slide. Yeah, we can providing anyway the recording. They can see, I think so.
Which recording?
We provide a recording of this session to the group.
You can share the recording of this session.
Yeah, that's why they can see.
Discuss what are the areas where we can expect 10 marks questions.
Yeah. And the final question is the clinical application for Ayurreshmi.
So clinical application of Ayurreshmi mainly comes related with the psychological conditions, even psychological conditions as well as some of the somatic conditions, especially psychosomatic conditions. So in all these conditions, you can write even psychological condition in the sense patient is of stress, patient is of different psychological conditions, depression, psychosomatic disorders like IBS, or wherever you see that whenever patient is having some rajas tamas involvement in the pathology, in all these conditions, you can clinically address this. Some of them we cannot tell all the Ayurveda points can be applicable. Some of the points for example, Jabashavu Jabaram Nityam Dana Nityam Darusinam or Nityam Shiragradasana. Nityam Shiragradasana. Nitya Shiragradasana is especially in old age patient or those who suffer from psychological conditions, or those who are having Vata Vyadis. So you have to study Ayurveda first. What are the main points included in that? And you just think where in which condition I can apply all this. Mainly the all Ayurveda is related with the psychosomatic condition, psychological condition. So you can think in that way.
Okay. Thank you so much, sir. I think, we share whole PPT, don't worry.
I'll share you some of the Vikarana slide, as well as there's one more method of asking question, like Kriyakala aspect. Kriyakala, you write the single sign Kriyakala way. So that is also there, but not in third paper, but in second paper of Kaya Chikitsa, you will get the questions. Formulate the treatment in Kriyakala aspect. So that is also there. I will share both the slides.
Yeah. Thank you, sir. We are concluding the session today. Thanks for your valuable timing, sir, and also giving explanation and answers for our students. And thank you so much, Dr. Ayush. And
thank you, Dr.
From our Ayurreshmi and our participant students, we are thanking you. Thank you so much. And we need support in future also. Thank you.
Thank you, Dr. Krishna. Thank you once again. Thank you to all.
Thank you, sir.
For the active lesson. Thank you.
And students, tomorrow there is a class of PTSR of C3 Roga. We will see tomorrow. Bye. Good night.
Krishna, thank you.
Bye.
Bye.